focusing on you. Innovations in modern medicine from your team of experts at UHealth, the University of Miami Health System.
'Tis the season for food, fun, and festivities. But for some, this time of year can bring on feelings of stress and anxiety, says Dr. Firdaus Dhabhar, professor of psychiatry at UHealth.
We all experience some kind of stress and maybe a little bit of social anxiety depending on what you're called upon to do, during the holidays. And the stress can come from, financial pressures, trying to keep many commitments in terms of time, social engagements, and so on.
Dr. Dhabhar, who studies how stress affects our immune response, says there are things we can do to feel better.
It can be as simple as calling a friend on the phone or doing something kind for someone else to help alleviate the holiday blues.
Try not to isolate yourself too much. Get as much sleep as you reasonably can. Avoid alcohol or go easy on it if you're experiencing negative emotions, and try to stay active.
Dr. Dhabhar reminds us that the holiday blues are only temporary, but if feelings of sadness or despair don't go away, there is help.
Going on for weeks at a time, sometimes continuously, would all be signs that you may be leaning towards depression, or at least should get it checked out.
UHealth's multidisciplinary approach to patient care involves studying our body's response to stress.
And what we discovered is that changes that take place in the body's immune system during short-term or fight or flight stressors actually enhance our immune defenses.
This research could lead to new therapies that boost our natural healing power.
If a patient mounts the good protective short-term stress response while they're undergoing surgery, they recover much better, much faster than a patient who does not naturally mount a good stress response.
Sometimes just focusing on what's good in our lives can change our perspective.
Most of us are fortunate enough that we have much more to be grateful for than worried or stressed about.